जेखन डिस्ट्रिक्ट अर्ली इंटरवेंशन सेंटर ने आगाना चंमतान बिसि आथियावनी बिसि चिचेतना अंगबा बिसारांखौ नोंथांमोनसा सिंगोनां सानराम बा वामांखौ परीक्षा आराम बियाब नेमना नोंथांमोनसा याखौ DEIC को आगाना नोंथांमोनसा स्क्रीनिंग कैम्प को जोंहा दालो आतेङा आरो या कैम्प को आतानि मुक्सवानि आरा आंथिं गार'इसो दंबा प्लाक बिसारांखौ जिरोनि आथियावनि बिसि चिचेतना अंगबा बिसारांखौ सानना बानागता आरो मना सिं प्लानिखौ नागता मुक्सोंनि जोंहा या स्क्रीनिंग कैम्प को आतेङा या स्क्रीनिंग कैम्प को जोंहा सालगनि नाव आतेङा मिजालो जोंहा आताहा मिजालो जोंहा वेस्ट साउथ गार' हिल्स नर्थ गार' हिल्स आरो ईस्ट गार' हिल्स नाव आताहा आरो वानो जोंहा sak खोलाथिसिनि बिसारांखौ जोंहा स्क्रीन काहा आरो नुनि सर्जरी खाना नांगोबारा आरा ऑपरेशन खाना नांगोबारा sak खौगोक्साखौ जोंहा मानाहा वानके दालबा अपसन नाके जोंहा वेस्ट गार' हिल्स दंबा बिसा गमुखौ आरो साउथ गार' हिल्सनि बिसारांखौ जोंहा बकामातेङा वामां जोंना इबागेन आरो जोंहा वामांखौ दाल स्क्रीन खागेन आरो जोंना माल्टी स्पेशलिटी हॉस्पिटल गुवाहाटीयावनि हेल्थ सिटी सेंटरनि कार्डियोलॉजिस्ट दङ आरो एनेस्थेसिस्ट दङ बिसों नामे चेकआप खागेन नामे निगेन प्लाक मेशिन नांगौ प्लाक नांगौबा बुस्थु नांगौ नुवामां राबा आरो वानके या प्लाक स्क्रीनिंग आरा इनदिन मामुं थांखा गंसाबो गामना नांगौ जोंहा या स्क्रीनिंखौ आतेङा जेनसल या वामांखौ स्क्रीन खागेन वामां खाथंसा दङ अने मामान केनसि मरे या बिसारांखौ जोंहा Tura ni Guwahati na जोंहा रुमांगेन हेल्थ सिटी हॉस्पिटल ना आरो वानो जोंहा सानना बानायनिखौ दाकेन आरो सर्जरीखौ खागेन आरो या सर्जरीखौ खाना गता खाथं सागुबा बिसांखौ सानना बाना गता ना मेन दाम राका आरो यांखौ मान सकजा उनिगमन याखौ आनसोनि गभर्नमेन्टनि गता नोंथां मानसा खासाय बिसारांना इनदिन सानना बानायनिखौ ना गता या स्किमखौ नाहा उनिगमन जोंहा दारांनाबा मोखांनि थै गिजा बिसारांना आंथिं गार' हिल्स दंबा प्लाक बिसारांना जोंहा या स्क्रीनिंग कैम्पखौ आतेङा दाउ नोंथां मानसा जोंहा या बिसारांखौ नासिमां बाननिखौ रोंबा नि सानसिनाबो दङ या बिसारांखौ जोंहा नोंथां गार' हिल्सनि बाग्रांवानिखौ संबादान जोंनि नोंथां मानसा मेडिकल टीम मोबाइल हेल्थ टीम ने आगाना गार' हिल्स गोबां कन दङ बिसं स्क्रीन का पमाम सान्दिया वामां गभर्नमेंट आरो गभर्नमेंट एडेड स्कुल आंची रे आमसान्दिया परीक्षा रा स्क्रीन का आरो उनके आंगनवाड़ी सेंटर आंची रे स्क्रीन का जेनसर स्क्रीन का वामां खाथं सा दङ अने सानसि छपाजम वामांखौ नोंथां मानसा वामां जोंना DEIC न आताता आरो उनके जोंहा वामांखौ आपसान नोंथां मानसा नामबाता चेकआप खानिखौ दाकना स्क्रीन खाना गता जोंहा नोंथां आफालनि जोंहा सुपर स्पेशलिटी हॉस्पिटल आंखौ जोंहा नोंथां मानसा काम नङा उनके सिखाङाव जोंहा मानिपाल हॉस्पिटल को बकामाता और अपोलो चेन्नई को बकामाता उनके दालो दे जोंना गुवाहाटीयावनि माल्टी स्पेशलिटी हॉस्पिटल नि हेल्थ सिटी सेंटर नि डॉक्टर आं जोंना बाय या दाकसाकियाव नानिखौ जोंना दाकिया उनके नोंथां मानसा वामांखौ जोंहा दालो स्क्रीन खागेन आरो स्क्रीन खानि जामनो वामांखौ जोंहा थक दाके जोंहा गुवाहाटीयाव रमाङि प्लाक साना बानानिखौ जोंहा उनगेन उनिगिमो नोंथां मानसा गार' हिल्स दंबा साकान्थि माबाफारांखौ आरो दिरांखौ नोंथां मानसा या नाकबा नामगोपा सलखौ राचिनागता जोंहा आबासिङाव दिदिया ताहा आरो उनके दाउबा दिदिया खुइङा या नाकबा सलखौ आंनि गभर्नमेन्ट अनांखुगेन आरो उनके सलखौ राचिनागता आंहा साकान्थिखौ दिदियान बाक्सा मरमन नाता स्किङा आरो या प्लाक अनानिया आरा हिन्दी नङा उनिगे मोनसिङा यानुनि गुवाहाटीना रुमांनाबा जोंहा हिन्दी नंगेन उचे दङा चानि थुवानि आरो उनके वामांखौ सर्जरी खानि आरो उनके सामरानि रिबाफ्लानि गमकान हिन्दी नंगेन उनिगे नाकबा सलखौ साकान्थिया नाफासिना साकान्थिखौ मतिया
I'm Dr. Naeem Raja. I am a consultant in Health City Hospital, Guwahati, working in the Department of Pediatric and Congenital Heart Surgery. I'm working, I basically am a surgeon and I operate on babies or children or even adults who are born with heart defects. Those defects where the child is born with involving the heart are known as congenital heart defects. So we have come here in Meghalaya to organize a free screening camp for those children from 0 to 18 years who might have heart diseases, inborn heart diseases which we call as congenital heart defects, and so that we can detect them early and we can give them timely treatment. So this is a third camp in Meghalaya. The initial two camps were in Shillong and one in Juhai, and Tura is a third screening camps, pre-screening camps. We have already been in ties with the Meghalaya state government regarding treatment of the congenital heart defect children. Basically, we have almost operated more than 100 kids from Meghalaya. Plus, I also want to say that we are already operating on babies and children of Assam, the state of Assam, who have heart diseases. So we have, in this last 1 year and 1 year 3 months, we have operated nearly more than 600 diseased hearts in babies and children, and most of the majority of them are living quite a good life and normal life. So my point is that why we want to identify this congenital heart disease, or what is the aim of this screening camp. First and foremost thing is that we want to detect and we want to diagnose early, because early diagnosis leads to early treatment, because it's very important. If we miss this heart defects and people or children comes at a late presentation, or else they are presenting in a very delayed age, so these treatments are not ideal. Although we can offer treatment to those children, but even after treatment the children might have some kind of limitations and they won't have any normal life. So they will have some kind of limitations. So that is our main goal, so that we can detect them early and we can treat them early, so that they can they can live a normal life. The good news is that all the treatment, almost 95% of heart diseases can be treated. And the best news is that it is now these treatments are available. All the newer form of treatments of congenital heart disease are available in our part of the country, the northeastern part of the country. You go back 2 years, 3 years down the lane, these treatments were not available in our country, in our part of the country. So these children who were born with heart defects either used to wait at home and die, or used to be referred to outside the state, where they used to go to different states like Bangalore or maybe Delhi, maybe Kolkata, maybe Mumbai, to get those treatments. Now we are proud to say that in Health City Hospital for the last 1 year, 1.5 years, we have been treating these defects. Almost all the spectrum of congenital heart disease are getting treatment, and we have been doing quite successfully. We have fixed, as I have already told, that we have fixed almost 600 to 650 hearts till now in this last 1 year, which is quite a big number, and we are planning to expand more. We are already in ties with Meghalaya government, Assam state government. We are already in talks with Arunachal and Nagaland state government, and also later on we will be in ties with all the other northeastern states. The best thing is that, and I am really proud to say that in Health City Hospital we have a comprehensive pediatric cardiac program. Basically, I can tell you that it is one of its first in its kind in the entire Northeast India, where we have an in-house pediatric cardiac surgeon, which is me, and we have a very efficient pediatric cardiologist. We have a pediatric cardiac intensive care team headed by a very good intensivist. We have very expertise in the cardiac anesthetic part also, who are trained in pediatric, and even we can deal with babies, newborn babies. We have trained nursing staff and all. So all these are available in Northeast India. So I'll request and urge all the parents, whenever they are being told that your child is having a heart disease, please come to us, so that you don't have to go out of this state or out of the country anywhere else. You can come to Guwahati, you can come to Assam, and we can offer treatment, early treatment and timely treatment. Regarding, people might ask, there is a very common question, parents ask that how much do we have to spend? Yes, heart surgeries are not cheap, it's very costly, because we have to use heart-lung machines, we have to stop the heart, we have to use heart-lung machines, and those machines, the equipments that we use are not manufactured in our country. It has to come from US, it has to come from Europe or China. So those are costly. But the best part is that the government schemes, the state government schemes, the central government schemes are so good that the parents don't have to pay a single penny. Plus our hospital, with the different non-governmental NGO support and all, Dr. Bhabadas Foundation and all, we have been trying to give each and every support to all the parents and children with heart diseases. They have to pay nothing, it's just free of cost. All the treatment, all the surgeries or interventions which are needed for the heart defects can be treated free of cost. So the parents, what we have done in our past 1 year, like people who have come from Meghalaya, we used to call like 1 or 2 of the parents and the child can stay there almost like within 8 to 10 days, maybe sometimes more. They stay there, they have their food, lodging and everything, with the surgery and all, and they don't have to pay anything. So that is the good thing. The parents don't have to pay anything, thanks to the government support and all those schemes which we are using.
Pankaj Sharma working as cardiac anesthetist, as senior consultant in Health City Hospital, and we have a very good team of comprehensive cardiac care. We deal both adult and cardiac heart diseases, and we have both the facilities, interventions as well as open heart surgeries. And our team is comprised of Dr. Bhavanda Das. He is very senior cardiac surgeon working in our hospital, as well as Dr. Sunil Dauka sir and Dr. Naim Raza, as well as we have pediatric cardiologist Dr. Saurav Das. And we are dealing with all the spectrum of heart diseases and with good results. And I feel very much privileged to be here in this team. And what I have seen in our health camp in Tura, that many patients, they have come very late actually. If we can catch them early, then it is very good. Many patients which may be inoperable also. So in future we will try to catch them early so that we can give proper care. And some of the adult patients also, we may find that have congenital heart diseases which may be operable. So not only pediatric patients, we are treating adult congenital heart disease also. So what I say lastly, that there should be good awareness program also, as well as health camps, so that the people come early and we can treat them properly.
1.9 PGS is a
Yes.
and 1.5 he has gained 1.9. So it's a commendable job, very nice job. Okay.
We're starting this new round. 25th May, and we got discharged on 24th June. So for 1 month he was in residency.
Hold the baby in your lap.
ठंडा लग गया सर तो सच में
टेस्ट खानो सुङा आरो नोंथांथां डक्टर निगेन सक्सेस खानो उनजवा बिसारनि डक्टर ना साखु साखु निगेन उनिगमन ये सैचुरेशन नां माइनि सेल माबा बैलेंस होंजिङा मो स्टेबल होंजिङा गेराम खमखो सुगुम नामनि थाबाते मासिगिन या खानिया मैना देदे ने आखांसिगन serious kan itu dalam
Kalau di lambatan, coba akan ayah mana. Tahu cuma ni cek kain ni apa deh, sana kan apa ni.
kali ada yang weight rang komening da free yang atri mai boni mu uni menta ada barang pun apa nanya ini angin kan kita deh dokter sing moga tahu ansun lima biar kan monitor di kanan mana itu jadi tulisan ini sama
School? This is a team from City Hospital. Okay. So for Speciality Hospital.
From Guwahati.
Hello, hi.
Jagdish.
Shashank. Shashank. Doctor? No.
Hello.
Dr.
Naim here. Nice to meet you.
Hello.
Sir, we are from DEIC itself.
Perfect. That's great.
So this is a portable echo machine.
Okay.
So basically we try to screen. So what we used to do is that we used to screen the heart. Although we will not be able to get all that, if somebody we suspect, suppose there is something, then we'll definitely call them. We'll further evaluate them properly there, and if needed, we'll intervene. So yesterday we screened almost 36 to 40 patients yesterday. So we was almost like 80% of them turned out to be. We will need some kind of interventions and operations.
We need some kind of solution.
Like open heart surgery. So these people have done a great job because the screening, primary screening was perfect. We have to do something.
Good job.
So that's good.
We're giving them free treatment at Guwahati.
Yes.
Actually,
So this is the third screening camp in here in Meghalaya.
In Meghalaya, this is third. Earlier
We used to do in Shillong and Juwai. So he's already operated in the last August 2023 in some outside the state, Apollo. So he has come for review. So this is that since he is separated in Apollo, it's impossible for the government or whatever the parents, they can't go there and have a follow-up.
Right.
There are problems there right now. If suppose like since the last 1 year I am here, I'm the cardiac surgeon. Okay, I operate on babies with heart defects. So last 1 year, since 1 year I have returned to India and I have been working in Assam, and we have started this program. So when we operate, if there is any problem like this, I will be there to tackle it. So this parents, this is just a few kilometers of journey they have to do regularly, yearly once follow up. It's not possible when they have to go back to Apollo again, Chennai. So it's not possible.
They went through our program initially.
What was the issue with this kid?
Now I have seen the minor defects are still there, which may not require any intervention also. But yeah, this is there.
Okay, that's it's by what makes sense. Congenital, yeah. Got it. Okay. We have this cardiac child specialist as well in Civil Hospital. Hi everyone, we are doing the congenital disease assessment here in Tura Maternity and Child Hospital for the 2 days checkup that has been scheduled. An early screening of patients was done by our hospitals earlier, and now we are getting specialists from Health City Hospital from Guwahati to do the final screening. All the patients from entire Garo Hills have come in these 2 days set. Yesterday was for North, East and South Garo Hills, today has been for West and Southwest Garo Hills. And so far, almost the initially screened 80 to 90% of the patients have been re-screened by the Health City officials and will be given free treatment at Guwahati under the Health City Hospital. The aim of the entire exercise is to ensure that with the help of our district early intervention center, that we are able to identify congenital diseases in young children from 0 to 18 years of age, so that an early intervention can be made in their life. This is an initiative under the Ministry of Health and Family Welfare, worked out by the Government of Meghalaya, and ensuring that we are able to provide quality lives to our beneficiaries, to the people of Garo Hills and to the people of West Garo Hills itself. I wish everybody the very best. If you are facing any issues, if you are facing any concerns, please drop in and visit Maternity and Child Hospital to the DEIC, the District Early Intervention Center, so that you can be screened and be sent for further inquiry or be sent for treatment at Guwahati for betterment of your life. I wish you the very best. I wish the team of Maternity and Child Hospital the very best. They have been wonderful at undertaking this job, and their intervention in all of this will definitely shape up many lives to come in the future. Thank you all. Thank you for your participation, and thank you for all your support.
Namun saya sumayo ang DIC office ni manager ba unit team lang ni member ako ang matel sengan namaka maina ya ang bisa ni katong sani ko wamang name sana chol ko aha ndake ya azal gani ko gani besio wamang ya DIC ni through open state na Kerala state na ini bisa ko katong sani ko operate kana ramangha ya katong sani ko mai taki ramamana ni chachina ba dua mandera nage chunga chungni civil hospital ampatius kangpa yang ni dimitiko katong sani ko suspect kaha nage wamang ampatiu ni doktorang 증거 Tura DEIC official 증거 산나니코 라나 왔다다 와망우나 리바온 증거 가통사니코 데클라르 카이 증거 등탕비아보나 양 산나라와 증아 땅카페 사랑 동자 그리하점 강한ong아 나비무나 정말 딱게 만게 니 심브라이 동아점 리바야 RBSK ni to wamang tangkap sabu gumene ko mane chungko sana ranga angni bisa tahu namin at sengi dongya diwa tahu changsate check up ko khathagen daw mayonga unja changa ko masigusa 나게 야 DIC니 매니저라고 텔라 아루 와모니 소셜 워커고 정아 텔라 마이나우 정코 케렐라치 산나 랑이온 정아 케렐라 호스피탈로 동호 정아 망아 랭니까랑이 그거 만나 랭니까네데 정아 랭귀지랑 프로블렘 뭐가 네바 정코 독도랑 롱인 가사인 사나 와모니 팀바 와몬 고방아 켈라니 독도르바 와모니 팀 고방아 다우 모텔라땡아 와모나 정코 롱 가사인 심사긴 사나 정아 우치에 살 소브리그니 와 가동 사한 옹기자 등탕 산이라고 만다바 정코 싹 측근그랑아 야 산다니고 마이다키 마시겠니 마 장치나바 동안 안증니 송아담라온 RBSK ni through check-up paniraku takinga wamang suspect ko manode yan ya DEIC office na riang China anche ko akan atinga wamang final sani ko declare kai dingtang Guwahati bar Bangalore Kerala yaramuna gurumeni tangka ko manne wamang sanani ko takinga Jadi nabi ya katong sanina namaigen tawang ni bisa namin dunginga ay sakantia ang ya katong saniko onchepi rajana ya kusana mati angani machudatnan ska ya tentang macaro ya DIC office ni manager ko arwa muni kamkai pa team ram konga changsa teng telaspe tele ya kanani konga machudatta tela